Hello, Mark Donegan, self-healing practitioner and educator, aka Goldilocks, ordained minister. Um, yeah, I want to jump on here for sure because pre-surgery. Let's see, hell, well, I got 6 more days. Thursday, talk to the surgeon today to refine the plan. Maybe I should call it. Um, yeah, my surgeon and I have talked about a lot of different things, and the end result is we decided to do just one level, lumbar L3-4, with a lot of instrumentation. Instrumentation means metal. I'm not sure all of it's going to be metal, but spacers, screws, and rods. That's what I'm going to be getting, and I, not much to say about it other than if you're going to do a surgery, get the get the most stable one, especially spine. Get the most stable one you can. When they talk about doing, what's the name of it? Laminectomies and microsurgeries and shit like that. Don't ever sit in front of a fucking surgeon who tells you, I'm just going to do microsurgery. It's not a big deal. It's a freaking big deal. I don't care how small it is. And it's like, they even told me that about this surgery. And, I should have just slapped them in the face as being straight up liars because there ain't nothing minimal about what I just told you about. A spacer, screws, and bolt and rods. Okay. Yeah. And even to this, you can ask, if I would have asked him, no big deal. You'll be fine. Yeah. Bullshit. Yeah. Until like yesterday, I think it was yesterday. They finally, dude calls me and goes, "Yeah, man, I got to get with you before your surgery." And I'm like, "Yeah, well, who the hell are you? I need to make you a back brace." And I'm like, "Oh, okay." And he was like scared. He's like, "Dude, your surgeon wants you to have this before surgery." So that's when I'm like, "Okay, surgeon knows this is gonna be like not like little, right?" He's already planning me for a back brace, which I'm kind of happy on because I remember being in a full clam before, full body brace, and it felt good to be stable for once in my life. And I actually just threw it out about a year ago because the damn thing, they don't fit after a while. You're, especially me, my body's changing so much, and it's going to change radically after surgery. So they'll pre-fit it for surgery, and it's only going to fit right until my body changes all around. And it's not going to fit right no more. But in the meantime, it's telling me that, yeah, surgeon knows this is not going to be no little deal. And I forgot to ask him how long I'm going to be in the damn hospital. But again, he's probably going to tell me one day. And I'm looking at this and knowing doctors going, yeah, right, bullshit, because surgery is Thursday. If I'm not out Friday, he ain't coming home on the week or coming back to work on the weekend to let my little butt out. I already been there before. They just go, oh, okay, you wait till Monday. Besides, they like the insurance money. So yeah, I got a feel walking into this that I'm going to be there like 4 days minimal. And yeah, they're not telling me, so good thing I remembered. And then the only other thing I want to say is, yeah, I'm still doing my workouts, for, best I can. I'm totally losing motion in my left leg. That's like the old surgeon. Nothing I can do about it. It don't move. It's not a pain issue. It hurts like hell, of course, but it don't move anymore. Okay. It does. It's like I have good days, bad days, but like today, I can't swing it. It's all the way up through the hip, and yeah, it only goes one little tiny footstep at a time today. And I can walk through it really hard, but then it just causes more pain over there to that side. And so right now and today, I'm not doing anything to aggravate it. Been really careful about not working my stick too much. My upper body's still having problems with numbness in this right arm, and it's like everything. If I don't move it and I don't do my workouts, it'll get worse. If I do too much of my workouts, it'll just tighten up and get worse. So it's that fine balance of movement, loosening, and strengthening. I can't stress the importance of all those things, of mobility and strength together. I think I've mentioned it before. I think at this point, most people will look at my movement and call it hypermobile. But I can guarantee you, like I told a couple doctors this week, I have better movement than any PT person I've ever worked with, and I worked with a whole shit ton. And it's even beyond that. So, lately I've not been trying to like mobilize myself. I'm pretty mobile except for that one side, and I can't, there's nothing I can do or bone to bone. So it's been more about balance for me lately. Spending a lot of time on one foot and the other because obviously I'm disbalanced, and I think they call it like a quarter inch difference in height for me, a quarter to a half one side to the other. But it's all because the damage has always been to the left. From day one, this injury over 30 years ago, it always went to the left. And not that the right escapes anything. What happens is by the time, like, I don't feel much pain in that right leg, but it also doesn't work. It doesn't want to move very easily. Um, and that's always been my progression too. And everybody's spinal injury is different. I just happen to know mine really well now. It, what that's what I want to teach people is you need to learn them. And there is no surgery fix. Like, I'm not expecting the surgery to fix me in any significant way other than taking pressure off of the nerve to that leg. That's what my surgeon and I were talking about this morning. I mean, that's what we had to be on the same page about. What are the expectations here, given my spine is a freaking mess? And that's why we went ahead, because it's really clear and obvious this place has got to get freaking fused. I've done a lot of research last week I hadn't done before because I didn't really need to. I mean, I knew the answers, but I just wanted to know for sure in my own mind. Um, yeah, there's no knowing the outcomes of these types of surgeries. And they have to be done at a certain point on certain people, especially, like I said, given my spine. I'm tired of surgeons telling me, no, there's nothing you can do. You're just a bad surgeon and I need a new one. So, yeah, we're going to do this one place and fuse it and then wait and see what kind of symptomology I got. I only have one other place I'm looking at that's the main source of pain. So if that happens to be relieved too, then double bonus. Again, expectations. Just expecting pressure off the leg and hopefully the leg to work better. But, talking with a surgeon, then your odds are not good. I mean, this guy didn't give me odds. What he did kind of scared me. Hadn't hurt any ears, but he rolled down all the list of all the things that could happen, including full paralysis. So kind of happy that he was, put that forward. And, when he got done with all that, I just looked him in the eye and said, dude, I've had 6 spinal surgeries. I've heard that list before. I know the risks. And especially this one. It's going in through the left side. Definitely could damage an organ or some shit like that. And he's just like, yeah, we damaged it, we'll fix it. And I'm like, yeah, okay, because damn right you are. So that's kind of how I feel about doctors. They're all different. It's just like basically this guy gets somebody you like and trust. This guy I got right now is very different from me. I've never had a surgeon that not so clinical. They usually act like they only really talk or smile or get connected, on a human level. And this guy, what's he do? He calls me like dude and stuff like that. Guy, he calls me guy a lot. We're gonna get you fixed, guy. And I'm like, he's talking to me like we're best friends or something. I've never had a surgeon do that. But now that I've talked to him further about, the complexity of what my spine's like, he is kind of obstructionist in a way, but I'm used to that. But he was considerate of all the other damage at all the other levels, and I appreciate that because this may not be the end. So I just wanted to get up here and say, and yeah, when you talk about meds, they are what they are. Keep them to a minimum. Try not to take them every day. Pain meds especially. But I think I'm on I have 3 different narcotic medications. Don't take any of them every day, and shouldn't take any of them every day. May after surgery, just kind of, short term, as they say. And most people disabled like me, we're not short term, we're lifelong. So you really got to work with that idea of constantly struggling both with your body and your medications. It's the way it is. And there's no answers. I mean, there's no cure. So get comfortable with whatever you're doing, make it work for you, and keep it, within reason. Like they say, moderation in all things. And that includes when you're broken. For me, it would be not to break myself any further. So I already know that going in. Don't need anybody, all you people that know me. I'm gonna take it freaking easy. Better freaking believe it. But I am gonna hit my rehab marks. I got a couple of people online that are watching, and they're my friends, and they're like, "Okay, Mark, you've been down a long time. We can't wait for you to be stable enough, to go push a little." And it's been months now since I've done that. Since I decided that, hey, pushing is just breaking this thing. And that was a couple of years old because I think it was probably, no, it was over two. I mean, it's been almost 3 years. I decided I needed this done. But just before I decided I needed this done, when there was a time when I thought I was going to get through it, and I was lifting I was carrying heavy weight, just to be straight honest, on my back. I was traveling a lot, carrying backpack with heavy weight. And I thought it was an okay thing. I was also doing a setup at the market, not just myself, but other people. So lots of up and down and stuff. And so I did it myself, is what I'm trying to say. And got to be very careful when I come back not to. And the hard part is social engagement because don't have much left. And I want to make sure that I continue that when I get home because it's really important. My market day, even this thing, making sure that I keep my diary up to date, best I can. And my grandson and my daughter are just awesome. I mean, that's why I do these things. So he has some guide when things get hard. And I've definitely had a hard life, but I'm thinking about my brothers that have passed. I carry knowledge from them and my father, but mainly my brothers that have passed, that life, about survival, because they didn't. And I have so far. And it's just little stuff. Like older brother gave me the part where you're hurting yourself, the masochistic part. Little brother had that a little, but he had more compassion and softness, and the world kind of rolled over him, even though he thought he was rolling over it. So that's a pretty freaking awesome brothers, and I do miss them a lot. And even though my little brother did lose one fight in his life when he was kind of medicated and multiple attackers, but man, did not want to fuck with the Donegan brothers, any one of us at any time. And then, of course, everybody always knew about Brother Bob. Older Brother Bob was, I didn't get a pass. I got beat on sometimes, actually, because of him. But there were other times where I got a pass because they knew Brother Bob might come looking for him. And there was a couple times where people did things to me, and I wasn't even feeling that bad about it. But he'd come over and picked me up off the ground with both arms, shook me a little, and said, you don't allow that kind of shit to happen. You're a Donegan, and I'm going to go deal with this and show you how to deal with this. Had a few of those with Bob. So now I know how to deal with those kind of things when they get there. And unfortunately, yeah, my family has that little anger gene in it. So, take that moment to pause, and I try my best, but still, there's stuff wrapped up in all of us, and I know that from my traumas, and from what I've seen come out of me when the cork gets uncorked, it's like, wow, it's like a lot of work to do. So I won't sit on here whining about all my maladies and emotional difficulties, but there are quite a few, and they never end until the day you die. So kind of love it when I see old people working their shit out. I just don't look as old as people my age. So it's, I hated it when I'm younger. I'm starting to hate it frickin' now because, yeah, it's no respect. People look at me like I'm in my 40s, and then I'm like, no, man, I could be your dad. Later. Peace out.